So I met with someone yesterday. He had met with someone who ostensibly does PRI, I don't know how long ago. And he was working on the exercises / techniques for a long time, but he wasn't having any permanent resolution. Now, I had posted last week about how you can have two completely different outcomes using the same techniques with two different people. One may have great outcomes, the other person may not have any outcome whatsoever, and I was speculating as to why that may happen. So this came up yesterday. Now, this little coffee stir from Starbucks, I always keep these with me. The first thing that happens when someone walks in, they walk up the stairs, I look at them, they look at me, I look at their face, I look at their feet. Why? Because face and feet tell stories. Once you have seen this play out enough, you know face and feet really do tell stories. And it's no different than when, I don't even know if poker is still really popular, that Texas Hold'em poker. I remember back in the day when it first got real popular, there was an article in the New York Times Magazine about these math quants, these amazing statistical, mathematical poker players who would play percentages. So they would see, they would see cards come out and they could calculate very quickly, the odds of what the next card may be. And they would play accordingly. So they were just playing odds and percentages. And then you had this old school player who was like in his 80s, and he didn't do that, but he had just seen so many hands, thousands and thousands and thousands of hands, that he intuitively could figure out what was going to happen, and he would bet accordingly. And some of that happens with PRI, or any profession where you're dealing with people. You realize everyone is, yes, an individual, but we all have patterns. We have behavioral patterns, we have patterns of thinking, and you generally fall into groups. And so once you're exposed to enough of these, if you pick up on it, if you're detail-oriented and you see these patterns playing out over and over, you kind of know what you're dealing with the moment you see somebody. And I saw with him, his chin was slightly off, although that was hard to perceive, but as he was speaking, I could see his teeth, something looked a little bit off. And sure enough, upon closer inspection, there was a very slight gap between the incisor, the top and bottom incisors on the left side. So when his teeth came together, they didn't touch completely. Now that's called the habitual occlusion. It has another name, but I can't remember what the name is. That is what your brain is accustomed to as being, if you just bring your teeth together, that's habitual occlusion. If you had started your life with two teeth that were touching, so top teeth and bottom teeth should touch the tooth. It's opposite tooth, okay? When that doesn't happen for some reason, now the normal occlusion is off and your brain will freak out about it and tighten you up as a protective mechanism. The person he saw previously, I don't know what he knows. Again, I've taken 23 seminars. I've had all personal experience with this, and I've seen it with so many people that I know exactly what to look for immediately, because if those things are present, you can't overcome them. So sure enough, there was that little gap. Now, I didn't even use this. This is small, thin. I used, because I didn't have anything else at that point, I had a very small plastic straw. And all I did was go like that, put it between the two teeth, so those teeth had something to touch, and he felt his walk changed, his gait, his walk changed. He felt different on his feet. All his tests changed. He loosened up completely. He noticed it. And then, so we tried a technique that would be typical for that person. First, we tried it without the straw, and he was doing the technique, breathing, and it wasn't working. Like he was even having a hard time figuring out which way his body was positioned, and I don't think he would disagree with that, in case he's watching the video. But then we tried it with the straw, and it was completely different experience. He was grounded. He kind of just instinctively knew which way he was facing. He didn't have trouble with the neck and the head. And what was really fascinating was upon his first or second inhalation, you just saw his right chest wall just open up. And that wasn't happening if his teeth were together, which you do on the left side, you bring your teeth together. Because his bite is off, his occlusion is off, the technique couldn't work. However, when I put this in, there's a little straw, and he had the contact, it worked no problem. But the problem is, of course, the moment he takes this out and his teeth touch normally, he's going to go back into his pattern. And that's how quickly it can work, because you're now on the autonomic level. That is sympathetic. He goes back into a sympathetic state. His body's in a state of alarm because his teeth don't touch properly. That's not everybody. For some reason, some people can have the same exact issue and their brain is like, I'm okay with it. The brain decides. Each individual's brain decides whether this is an acceptable scenario or not. However, when it's there, you can do, if it is an issue, like it is with this gentleman, you can do all the exercises in the world, all the techniques in the world. It's not going to overcome it, because the moment the teeth touch again, he's just going to go back into the pattern. But no, actually, okay. Sometimes, especially if someone does not have left molar contact appropriately, they feel more on the right side, sometimes the techniques will actually, the jaw will shift slightly, and now they have a normal occlusion back, and their brain relaxes because now everything's touching properly. That's not happening in this case, because it's just, there's a little gap, so it's basically an open bite, and it's not gonna go back without having some sort of dental intervention. So I can't help him directly. All I could tell him, and he realized this because he saw how quickly his test would change by whether his teeth were touching, he will somehow, I suppose, he'll have to talk to a dentist. I'm not sure that they'll have any clue what he's talking about, but they can see that those teeth are not making contact under normal occlusal circumstances. So maybe he can put some bonding agent, something to make that top tooth and bottom tooth touch during normal occlusion, because that was making all the difference for him. So just a video on why I could see this and maybe someone else wouldn't see it. It's all about pattern recognition. I just see things. It's just a gift, I don't know. But I've also experienced it, so it makes it more real to me, and I know that if you have that issue, you can't overcome it. So I'm always looking for those things right in the beginning. And but another point of the video is that teeth can make a big difference, and it could just be a small thing where a dentist may be like, not a big deal. From their point of view, it may not be a big deal. It does not affect how he's chewing or talking or anything like that, but it's affecting how his body is responding, how his brain responds to it. And that's the big deal, and that's what I wish more people would understand. So if you are trying to learn PRI and you are in healthcare, physical therapy, personal training, whatever it is, and you start with PRI, you gotta take it to its logical conclusion, which is all up here, because you do not exist independently of your eyes, your teeth, and your feet, and those are the three big sensory inputs that can change things.